And if you're in the area, come past, come say hi. And we've got a very special guest with us this morning. Oh, ladies and gents, I've been watching him on the Insta. He's even an artist. He's got a song out. Oh my gosh.
Yeah, he's got records.
He's got records.
Records, bro.
He used to gym with our very own head girl, Alison.
Really?
Yeah, man. Yeah.
Yeah, Alison's very selective who she puts in work with.
You know what I'm saying?
We've never been invited to anything like that.
He only comes to KZN for 2 days every few months, and that's to do work because he's so wanted and needed here. And he flits around the country, continue to do what he's doing. He is here to tell us everything we need to know, not just about aesthetics, but everything about what we need to do just to feel good about ourselves. You know, needles, no needles, doesn't matter. Please, ladies and gentlemen, welcome Dr. Reza Mia. Yay! Dr. Reza, welcome.
Thank you so much. Thank you for having me.
Yeah, honestly, we're so glad that you are here, and you've come with your very special guest. She's here holding your camera for you. Where are you going to be working from, by the way, when you're in Durban?
We're working in Mhlanga, just down this road.
Where in Mhlanga? Oh, you'd like to tell us? Was it a secret?
Well, we like to keep it confidential.
Oh, okay, just in case.
But anyone's welcome.
Oh, okay.
Send us a WhatsApp. We can book you.
All right. So we are talking aesthetic medicine today. For those of people who don't know, what exactly, when you talk about aesthetics, what are we talking about?
Basically, it's using things like botulinum toxins and fillers, platelet-rich plasma, basically anything that we can use to increase the texture and the hydration levels, the aesthetic tissue quality of your skin and your hair and your body. We bring them all together, and that's aesthetic medicine. It's a very new field even.
Yeah.
Still evolving, still growing, and that's what's really exciting for us.
Okay, so let's talk a little bit about the doctor. Doctor, how on earth did you get to be where you are now? So where did you grow up?
Always in Joburg. Studied in Joburg,
Yeah.
Wits, just been there my whole life.
And then I know that you did a little bit of extra studying after your studying. I saw something about the University in Liverpool, is that correct?
Yes, good. Good research. I did an MBA because I was working at Barra and I saw that people were dying not because of any lack of skill from any doctors or nurses, but because of a lack of resources. And eventually realized it was more, it wasn't really a lack of resources. And I thought, well, let me go and study something about business and management and see what we can do. Maybe that's a better way to help people.
Yeah. And
so I started an MBA, and it kind of bit me, the idea of working with business and ideas and entrepreneurship. And so I started a master's in finance after that to look at doing, how to bring finance in, how to make things work. And I've actually used it still every so often.
Well,
I'm gonna need folks to slow down. This thing's a little bit too fast right now.
Medical doctor?
Yes.
Okay, so give us the timeline. So
because this is a lot of studying.
Yeah,
I did hear,
and
look, Alison, our best Alison, she's a fan, and she was just like, Gary, don't even ask him what he's doing for a hobby, you will not believe. So we're gonna get there, but like, it doesn't seem like there's an issue with the amount of work you're prepared to do. So you became a doctor and then did MBA.
Well, internship, comm service, and then an MBA, and then I did a finance master's, and then I also did an advanced diploma in aesthetic medicine.
So right now he's pointing at his right boob.
Which you need,
So it says advanced diploma aesthetic medicine. Oh, but yeah, because there's a lot of people these days that feel like I've got a hand and I've got an injectable, let's go.
So legally you don't need anything. You just need to be a doctor or a dentist. And for me, it was more just in case that became a regulation or to get the piece of paper. But it was more, as I went to the course, I would attend the lectures and then stand up and give a lecture because they kind of wanted people with experience to give the lectures. And I started doing this in about 2010, 11.
Yeah.
Because I brought Dr. Ray here. I don't know if you remember him from Dr.
Yes. Yes. Yeah, you can come to me. I heard about Dr. Ray coming here. So you're welcome to share my mic.
So we brought him here to promote his cream. He had a cream called Sensual Solutions, and we were importing the cream.
Yeah.
And one of them was called Inhibitox. It was meant to be like a toxin-like cream, and it actually worked when the skin was thinner, but it didn't really do what toxins can do, botulinum toxins can do.
Which is what we know as Botox.
That's what you know it as, yes.
Yeah.
I'm not allowed to say that.
Oh, you're not. Okay, you've got to say the whole.
Botox is the brand.
Yes, no brand name.
It's the brand name. Botox is the brand name. Oxytocin is the formula with the ingredient.
Damn, thank you. Okay, so we have to say the whole thing every time.
We have to.
Otherwise, you're promoting the brand and they're not paying you to do that.
Exactly. But apparently, a doctor can go to jail for breaking that rule.
Oh, sure, but okay. Well, thank you for letting us know that. We don't want any issues here.
There's no jail.
There's no jail. We'll bail you out, doctor.
My friends and the people who were buying that cream kept saying, why don't you just do the injections for us? And why don't you just do the botulinum toxin for us? And so I thought, okay, well, let me go and do a couple of courses and start working on it. And I started doing it very much part-time, just for those people.
Oh, okay, so this was not actually the route that you were looking at going at all.
Plan. I think this didn't even exist when I started med school. And people kept coming back, and so then it kind of evolved and grew into the full-time job.
Initially, when, like back in 2010 or whenever this was, the people that were coming for botulinum, what's the word again? Botulinum what?
Botulinum toxin.
Botulinum toxin. Can I just call it the B?
Toxin.
No, BT. Huh?
The BT.
BT is good.
People coming for the BT. Was it the generic, older, wealthy lady? Was that the stereotype?
I think early on.
Yeah.
But very quickly, within 2 or 3 years, our mix became about 40% men and across the board.
40?
I would say 20 to 80 years old. A nice little, if you look at the normal distribution graph, that's basically our patient breakdown.
Oh, really?
And it's quite, I like it like that. You get to work with different problems, different
and when it comes to skin tone, do our black, white, Indian and colored community get BT the same, or is it majority? Because look, I've grown up with the idea, and my brown friends would tell me, "Well, Kerry, black don't crack," Like my gogo, she was like in her 60s and still perfect skin. So do we have more Caucasian people getting BT?
No, it's not the same. It's So if you think about the muscles that pull your face down, your triceps of your face, jowls, your turkey necks, the frown muscle, their job is to basically push everything down. And that's the same for everybody. It doesn't matter what color you are. So you're more resistant to the sun, the darker you are. So you're less likely to damage the texture of your skin.
Okay.
But the actual process of putting your skin down and getting jowls and sagging, that's normal. Everybody gets that.
And when it comes to, because you've done, because you're a doctor but are you a surgeon?
No, I've worked in surgery, I've assisted in surgery. So my brother is a plastic surgeon. I've assisted him quite a bit.
So is this the brother? Because I saw another Dr. Mia with the peri-umbilical breast augmentation.
That's correct.
Is that what you were part of?
Yes, Dr. Ray was here.
Okay, please tell us what, and I know that you were in there and it's only been done once, and I don't know if it's been done again since, but I know it was successful. What on earth is that? Like how?
So it's basically, he takes a tube. We brought him, and all the plastic surgeons at the time came and watched, and we recorded it. So it's on video somewhere, but I don't know where that video is.
The way you look to the side.
Kitchen.
Yeah.
So anyway, there's a metal tube that he slides up through the belly button and feeds an empty, kind of like a rolled up empty implant.
Yeah.
And he folds it up and pushes it all the way up, and then fills it with saline once it's already inside.
Tell me you were right.
So
it's a button pump.
So it is like that, and then you disconnect it and it stays in place. So it's quite interesting to see, but he obviously uses a fiber optic camera to make sure they.
And then that woman had a breast augmentation without no lollipop, no anchor, no underneath, no nothing, just her belly button scar.
And so I know the surgeons will do it in a way sometimes now where if they're doing a tummy tuck at the same time, they'll work through that level. So then you still have a scar from the tummy tuck like you would have had, but you don't have any visible signs around your breast.
Your boobs.
Yes.
And do a lot of people do like a 2-in-1? They go, well, I'm going underneath the knife. I'm going, under anesthetic anyway. I might as well do a few things. Obviously it's a money thing, but if you're paying one underneath it,
folks definitely do that.
You reckon? That's
they call it a mummy makeover.
A mummy.
Folks definitely do that.
A mummy because you're going to be wrapped in bandages, or because it's for the moms? You know what I mean?
It's because for the mums. After they've had babies, they've decided that's it for them. they want to now just look after their body, and so that's why they'll do the tummy tuck and the breast at the same time.
My goodness. Okay, so now I want to go back, and guys, if you have any questions at any point, just jump in, please. But on the WhatsApp line yesterday, I had someone asking, and I think you've answered maybe, the scale of men to women that are coming in for your injectables, and you said it was like a 40-60?
60-40 women to men, yeah.
Okay, so the women still like 60, the men are in for the 40%. And I heard, and I don't know if this is for real, that these days you can get filler. So the filler versus the BT, the botulinum, the BT relaxes the face, right? So that'll stop you from your frowning and your lines. But then the filler, well, that's what the women are getting for the lips and the cheeks and whatnot.
So everybody gets it. Men, women, that's what we use for cheeks, noses, under the eyes, nasolabial folds, lips, jawlines, body. So it goes.
Where do you put filler in the body?
Well, you can put it on the butt. You can put it into.
But how much filler would you need to put in the butt?
So there used to be something, a product that was higher volume, hyaluronic acid, 20 mils in a tube. You get now 10 mils.
Yeah.
And so anywhere from 10 to 50 mils is normal.
And this just happens in the chair. You just like bend over and you just pop it in. What? I'm just saying, like, you're not getting an anesthetic or anything. Don't owl me. These are real questions.
Bends over the chair.
Well, I'm just wondering.
Well, I'm gonna tell you this right now.
It's like when you get a tattoo on your back.
If your doctor is like, just bend over here right quick for this procedure, you need to find a different doctor. Leave that practice. That boy might not be doing it right.
I guess kind of in between surgery and bend over, you know, it's...
in between surgery and bend over.
It's nice and it's relaxing, and I always like that environment. It needs to be not like you're going into a hospital and feeling like you're sick.
Yeah.
It must be something relaxing. So if you come see us in Joburg, you'll see animals and rivers, and you know, it feels like you're not in Joburg.
Okay, and what I was going to say is with this filler, we know filler to be, and again, I don't know what the brand names are versus what the things are, but you get that it's like a tube and then they get injected in and whatever. Apparently now you can use your own body platelets, blood, something. Is this true, and what is it?
So one of the things that has changed a lot in the last couple of years is the advancement in autologous cells using your body to treat yourself. So we used to have platelet-rich plasma for a long time.
So that was pretty popular with like healing injuries, for example. Like that was in sports medicine. So if you got hurt, you had knee surgery, shoulder surgery, folks would get your own blood, they'd spin it, take the platelet rich and then inject it back into the injured site for faster healing.
Correct, exactly. Yeah. And we do that with our physios, but we also use it for skin conditioning.
So now you've got vampire facials and do the same thing, isn't it?
Yes, correct. That was one of the trademark techniques of doing it.
Yeah.
I'm shocked.
And then obviously there's also the P shot and the V shot.
Yes. So what you know about the V shot, Kismo?
Wait.
Kismoto?
I want to know about this.
Kismoto, what you know about the P shot?
Wait. I would like to know more about it. So
the V shot.
The V shot, I presume V for vagina, right?
Yes, correct.
And P, not a crude word for vagina, for penis.
Yes.
Okay. And this is what I'm just double checking. And these are. Is this what we're saying? Can you use platelets for? And
platelets, correct.
Why would I want to get filler in my V?
So that's not yet the filler. So this is just platelet-rich plasma using the cells to enhance the tissue quality and to get it to function better. So we notice, in women, it's mainly post-pregnancy or post-menopausal, and they want the vibrancy of the tissue to come back.
Just, and is this for a feeling situation, or is this merely for aesthetics?
No, it's more functional.
Okay, so it actually it'll change the intimacy and whatnot. What time is it? Our kids at school yet? 7:30.
No.
They're not at school, they're late, and they need to hear this. And same for the P shot, I presume.
The P shot, it's meant to be functional as well.
Yeah.
So it does increase size, and it also increases the functionality. But what we find is that with men, they're a lot more experimental. So with women, they usually will have an actual need for it.
Okay.
Men are curious. What would it be like if it was a little bigger and worked a little better?
Dudes are just...
And so I know, they're just like, hey, let's just give it a try. So I just would like to know then, do you numb the area first, or do you just go ahead and straight up just pop a needle in there?
No, we numb it, and
Yeah, with that
because the
topical.
skin is thin, it actually works much better than other parts of the body. So it's not painful.
And even for the V shot.
Even better because it's mucosa, so it absorbs the cream even better.
Oh, is the numbing a cream?
That topical, yeah.
Oh, it's not, so you don't even feel the injection whatsoever, because in my head I'm thinking you've got to lie there, stirred up and inject.
A little. It's
you
not
feel
like you feel zero, but
Okay.
it's not terrible.
Oh, la la. How you girls feeling? You good? Okay, and then for the filler and using your own body for filler. Okay, hold on, it is 7:30. I need to go to news now. But I want to come back to using your own body for filler, and then I'm going to talk about your hobbies. This time's going too fast. All right, this is Radio PlayZN. We have Dr. Reza with us. If you have any questions for him, 072 330 3337, and we will get all his information as well. So if you're feeling a little bit scum to share your questions, we will give you his details that you can go and have a consult yourself, face to face with this man who's only in Durban once in a while, just by the way. So I presume there's a waiting list. Radio PlayZN. Are you here for 2 months or every 2 months?
Every 2 months.
Every 2 months. It's Miller and the Kid. We'll be back after news, sports, and traffic.